essentially are creating an internship for undergraduates, us being undergraduates ourselves. So it's really cool because we are essentially making our dream internship. This is what we would want to do if we were applying for an internship. We get to do everything. We're going to different site visits, we're interacting with doctors, we're learning as we go, and so it's just a really interesting concept that Dr. Clancy came up with for us to do.
I think kind of what we've learned through this is that traditional medicine is doctor-centered.
Physician-centered.
It's doctor-centered.
One-on-one physician-patient encounters.
Meaning everything's kind of based on what the doctor does. So if the doctor can come in from 8 to 5 and see the patients, then that's what's going to happen. He'll see one patient, move on to the next room. Community medicine is more of a patient-centered type atmosphere.
The way that our current healthcare system is structured is to encourage procedures and things like that, and less time talking with patients, which is something that is really important to a community medicine doctor, because you can't understand what's going on unless you talk.
A doctor may see several of the same cases over and over and over again and treat those on an individual basis, and he may do a very good job treating them on an individual basis, but you're never going to fix the problem that way.
It's like the
it's like, how do you fix something
versus...
that's broken? Do you just replace it, or do you just try to temporarily fix it all the time? Like a flat tire, do you just keep patching it? When are you going to get a new tire? You know, if the tread's worn, it's going to blow at one point. When do you get a new tire? But I think people are scared to, you know, just stop it. You know, I guess people are just so satisfied with what's going on now that people don't want to try something new. People don't want to, you know, put on a new tire.
Being in North Tulsa was just crazy for me to see, first of all, and then going in there and seeing all these people that are just in desperate need of help. And yeah, I think we were all a little taken back by that. And honestly, it just really broke my heart, just because I just knew that these people had potential, but they just had no means of getting that. And I think that that's what this whole community medicine idea is about, is giving someone a little bit of help so that they can go off and eventually start something for themselves.
I never really had particularly positive connotations when it came to medicine. I think that this idea and this school is a really beautiful thing, and I think it's wonderful. And I think, like Kathleen said, that's how all medicine should be.
We invite you to learn about us, and we invite you to be part of the summer internship program, where you really start to wallow in what community medicine is.
It gives everyone the opportunity to really step up and become more involved in the community.
Look around you and look who we've already attracted from all over the country.
I really encourage anyone that can to apply for this internship, because you're going to have the time of your life.
OU Tulsa College of Community Medicine is really doing something that's on the verge of something great. And to be part of that would be something amazing.
All doctors need to know about the problem at hand, and so this internship is a great way to really learn about that problem.
It's not just a one-on-one patient thing, it's realizing the problem and realizing the need for what you have to offer.
And so that's what you're doing with this internship in many ways. You are changing this school.
This isn't a sideline program. This is a program you actually get to be part of it. You submerge yourself in what we're trying to do.
But go into it with an open mind and know that you'll probably be exposed to things you've never seen before.
Open your eyes to what medicine is like and what it can be.
It's not too early to start thinking about what kind of doctor I'm going